Welcome to another episode of Disrupt Health Tech. I am your host, Wendy Austin, and I'm so glad that you can be with us today to talk about a fascinating application of VR technology. Let me introduce our guest, Dr. Kryn McClain, the CEO and founder of Catapollo VR, a groundbreaking virtual reality platform that harnesses the power of technology and clinical expertise to create immersive VR learning modules designed to enhance safety, outcomes, and quality of life for neurodiverse populations. Dr. Kryn McClain has over 10 years of experience as a licensed professional counselor with a strong foundation in behavioral healthcare. Additionally, Dr. McClain holds a doctorate in healthcare administration, allowing her to understand the complexities of the healthcare landscape and the ability to navigate complex systems. With prior experience in starting and growing successful behavioral healthcare organization, Dr. McClain combines clinical knowledge with entrepreneurial success to drive the vision and growth of Catapollo VR. Welcome, Dr. McClain. I'm so happy you can be here with us today to talk about Catapollo VR.
Thank you so much, Wendy, and thank you for the introduction.
All right, let's start by letting the audience know that Catapollo VR has a library of evidence-based learning modules for educators and healthcare professionals in the behavioral therapy space. It can be delivered through VR technology. Can you explain who should be using this library and in what settings you see it being useful in?
Yes, absolutely. So we definitely see it being useful in schools such as special education classrooms and really anywhere in the school that could benefit from our technology, and also behavioral healthcare providers. So by that I mean BCBAs or behavior specialists, all the way up to big healthcare organizations. So we hope to have a real wide customer base because our vision really is to get our modules into the hands of anyone who can benefit from them.
All right, great. My sister is in the public school system as a special ed teacher. So do you see this being applicable to her in that setting?
Yes, absolutely. And please connect me with her. I'd love to speak with her. And I think this could be extremely applicable and help her in a way that may not have seemed possible before.
Yeah, I will. I definitely will. I have to say that I really love how Catapollo VR is using cool technology like VR and linking it with treatment plans. Usually when you hear about VR and the education, it's usually for physicians and HCPs to do CMEs or continued learning for their own purposes. But how did you come up with the idea to use it in treatment plans?
Yeah, absolutely. So our COO of my first company, Catherine Angel, she really came up with the idea to combine virtual reality with evidence-based treatment. So we started to develop a few modules within our first company and quickly realized, wow, this could be incredible to get this out there to other companies, other educators. And the more I shared our idea with people, the more we realized that we could really grow and scale this to help and reach people on a nationwide level.
Oh, that's great. Perfect. I love it. So let's talk about impacts. What type of impact do you think this will ultimately have for either the patients or the therapist?
I think we're going to have a dichotomous impact. I think we're going to have improved safety, and I think we're going to have improved outcomes. So Catherine's been using our modules in her group setting, and not only did she note that I shouldn't say people, the kiddos were much more safe than she anticipated, they were learning at an expedited rate. So I'm really hoping that this will improve the safety and quality of care for both the therapist and for our clients and educators and students.
Yeah, that's great. That's great. So let's dive in a little into the type of modules that you have in your library. Are they all clinical based, or do you have some that are just for fun?
Yeah, I'm so glad you asked that question because one of my things just in life in general is that it has to be fun. So, for example, we've developed this whole module called Castle Quest, where a group of three individuals have to proceed through these trials in order to bring the princess her medicine in time. There's a whole
Yeah.
story arc narrative there. But the point is, if the participants do not work together and share their clues verbally, and listen and retain that information, they will get stuck. They will not be able to proceed in the
Yeah.
module. So they're in a medieval castle setting with 4 or 5 scenes, and there's puzzles and clues that they have to put together. So it's fun, but there's also 5 or 6 clinical interventions that are woven into that skill set and into that module. So the point is, I wanted to use this technology as a way to really engage this population of teenagers or young adults
Yeah.
who they don't go to therapy now, they get to go to a VR experience. So my goal was to really entice this population to want to come to treatment without thinking it's treatment.
That's so cool. You'd mentioned the therapist, I think. So, does the therapist see what they're doing in the game, if you will?
Yeah, so they can absolutely see what they're doing. So when they're in the VR headset, for example, Oculus has a streaming component, so they can record it or they can live stream it. The idea is that this is to augment treatment. The therapist or the educator should very much still be in the room and very much still be participating. So that's why we have our module companion that informs the professional what's going on in the headset, what are the options they're seeing, what are the potential
Yeah,
choices and outcomes and things of that nature, and also how to really define those interventions.
that's great. So let's talk about the neurodiverse population as it relates to your modules. How do these modules really help this population? And if you don't mind explaining what neurodiversity means to our audience.
Yeah, absolutely. So neurodiversity really just means a different way our brain thinks and functions. So for our purposes, we're specifically targeting autism spectrum disorder and also attention hyperactivity, attention disorder or ADHD, so that we can help this subset of kiddos in a way that is engaging, but also breaks down these tasks, what we call a task analysis. So tying your shoes, we might just think, oh, here we go, but there's really maybe 10 or 15 steps in something in a skill like that. So we use different evidence-based treatments to help this population learn in a much more effective and accelerated way.
And I think I forgot to ask, but the age groups that the modules are really designed for, if you could explain what age groups you're really targeting.
Yeah, so we're really targeting 12 and up. So some of our modules are a little bit more on the adult end, such as scheduling a medical appointment. Most 12-year-olds don't have to call and schedule their own medical appointments, but if that's a skill you want them to learn, that's great too. It's all there, it's appropriate for all ages, but where we think we're really going to shine is using those real life, real images and being very sensitive to the age population. I think you're going to see that ages 12 and up are really going to respond to our modules.
Oh, that's good. Um, how would HCPs or behavioral therapists access this module library? Is it widely available today, or do they have to go through some special certification or training with you?
There's no special certification or training. People who are licensed or educators can just access them from our website. So they would have to, of course, purchase a subscription, and
Right.
then we would give them a login, much like Netflix. So you would go in and type in your username and password, and boom, there you go. There's our library of modules ready to rock and roll.
Oh, very nice. So, what if someone doesn't own a VR headset? Are there any other delivery methods for your modules? Are you exploring other technologies to allow users to access these modules?
Yeah, that's a great question. And that's something we took into a lot of consideration because a lot of neurodiverse participants may not want to wear a headset. So there's
Oh,
that
yeah,
twofold that where there's a sensory issue potentially, or perhaps somebody doesn't have the ability to afford a VR headset to implement our modules. So what we did was we kind of put our heads together and came up with a web-based solution. So
yeah,
anywhere you can access the internet, you
yeah.
can access our modules. your phone, your tablet, your desktop computer, your laptop, or a VR headset.
Yes.
So anything, anywhere, a gaming system, as long as you can get to an internet browser and you have a good internet connection, you should be able to run our modules just fine.
Oh, great. That's perfect. So finally, what is the next steps for Cat Apollo VR? And is there anything that you would like our listeners to know about Cat Apollo that we haven't talked about yet?
Sure. So next steps is really getting out to a couple conventions this summer. We're going to be traveling to State College to the National Autism Conference, and then also to Washington D.C. for the National American Psychological Association Conference to really start to get the name out there. But, we really want anybody who's listening this long to know that we're here to partner, we're here to help, we're here to help deliver and augment treatment or education, to give you access to tools that you may not have had access to. So instead of building out a kitchen in your office or bringing in that laundry machine, we're going to film that. So we have those modules so that you can provide a greater myriad of treatment settings as well. So we hope to hear from you. We hope to partner with you and help you, with your strategic goals and plans.
I may have another group for you. I just had a thought.
Great.
But anyway, I wanted to thank you so much for your time today, Dr. McClain. And I really enjoyed talking about Cat Apollo VR and how you're using VR technology to deliver treatments to neurodiverse populations. For more information about either Disrupt Health Tech or Cat Apollo VR, please see the links below. And thank you so much for attending today. See you next episode. All right. Thank you. Thanks for tuning in to Disrupt Health Tech. We hope you found our conversation today inspiring and informative. Remember, the key to success is using technology in an innovative way to improve healthcare experiences and patient outcomes. So keep a lookout for ways to challenge the status quo and keep innovating. See you next episode.